Some really good information coming out there. LaDawn Davis is standing by with a geriatric specialist for the latest on how the virus would affect that community. Good morning, LaDawn.
That's right, Makushla. The coronavirus is a global pandemic that will adversely affect the vulnerable among us, the elderly. Now, joining us live here on the Morning Edition to tell us more about that is family medicine and geriatrics physician, Dr. Keith Rivers. Dr. Rivers, welcome to the Morning Edition.
Hi, good morning.
So the country recorded the first female victim of the coronavirus was a 61-year-old woman. Why is the elderly, so vulnerable to this virus?
Well, the elderly is more vulnerable to any virus, including coronavirus, because of two main reasons. First, older people suffer from underlying conditions that make them more susceptible to contracting any virus, such as heart disease, lung disease like asthma, COPD, and so they're less able to cope with, and they're also less able to recover from these conditions. And second, because of our immune system, the mechanism isn't quite understood yet. But as we age, the immune system is less robust than in younger people. And so older people, because of that, a weakened immune system, they're more able to contract viruses such as Covid-19.
What are some of the symptoms, the elderly should look out for, to avoid exposure to the virus?
Well, any type of symptoms like that mimic flu-like symptoms like runny nose, cough, fever, muscle aches, decreased appetite. But most importantly, what you really want to look out for is a fever, shortness of breath, and a cough.
Now, the Family Island, elderly residents living in the Family Islands are more susceptible, to the virus. Talk to us about, the measures they should put in place to actually protect themselves over there.
Well, like in any main city like Nassau or any populous region around the world, those who are on the Family Island suffer the same risks. And so there are very, very simple measures that can be done. I can't overemphasize something that's very practical, such as frequent hand washing. That's the most important thing. But also social isolation. We're an archipelago, so people are traveling to and from Nassau to the Family Island. Nobody stays put. So you should avoid people that exhibit symptoms of the Covid-19 disease, such as like a runny nose, cough, fever, any flu-like symptoms. So social isolation and avoiding being in crowded places, and that might even include going to church, which might break some of their, traditions.
Give us some statistics about the elderly population, not only here in New Providence, but around the Family Island.
Well, according to the 2010 Bahamas census, there were 27,000 people who are over the age of 65. And so that accounts for, to tell you the truth, a small segment of our population overall. And so we're still basically a young nation. But keep in mind that even though the elderly population might not be as much as the other segment of the population, the lethality of the disease in this segment of the population is much higher.
And how many people or persons can you say in the elderly community have died around the world?
Well, according to the latest statistics, if you would go on the WHO website, the total amount of people who have died from COVID-19 so far is about 9,000 people. Believe it or not, 8 out of 10 of these people are over the age of 60. And so you could see the impact on the older generations is much more, the burden is much heavier.
I know this is a tricky question, the common cold versus the coronavirus. Which one, can you say would have the most impact on the elderly?
Well, to tell you the truth, this year has been a very bad flu year, believe it or not. And even though the vast majority of the people who contract the coronavirus, they're going to recover from it, they're going to have mild symptoms, but on the elderly population, this is different. Now, to compare the common flu with the coronavirus disease that we're seeing right now, believe it or not, the numbers are far, far higher with the common flu. And so if you would look at the CDC website, there were over 37,000 deaths from the common flu alone last year. This year so far, and I'm not trying to trivialize the impact of the coronavirus, but so far, the total number of cases globally has only been 9,000. Not to trivialize it, because every death is very, very, very sad. But for some reason, the coronavirus has been, I would say, more contagious. It spread much faster. But that's not to mention that's not to undermine that the flu is very dangerous as well, especially on the older population.
Dr. Rivers, thank you so much for joining us here on the Morning Edition, and best of luck. And thank you so much for sharing that information for the elderly in our community. Thank you so much.